Thank you, everyone. Thank you, everyone. I'm so happy to see you. I'm Barbara Paxton. I'm the director of Board Strong. And we are, for those of you who don't know, we're a nonprofit organization whose mission is to strengthen the governance of nonprofit board of directors. We provide board recruitment and placement, training, consultation. We also have a killer online board recruitment platform that connects organizations to talented and diverse board candidates. Little housekeeping, this roundtable will be recorded. You'll receive a link to the recording tomorrow. And please use the chat box for any questions for the panelists. We'll save 10 minutes at the end of the conversation for questions. So thank you for coming. We at Board Strong are passionate about the benefits that diversity in our leadership brings to our organizations. With diverse perspectives on your nonprofit's board of directors, you are in a stronger position to advance equity, plan for the future, make prudent decisions, and take full advantage of opportunities. We've decided to focus this roundtable on one aspect of diversity, including people with disabilities, because we believe this group does not receive the attention that others do. However, all of our organizations serve people with disabilities, and we believe we should all work to include their perspectives in our leadership. Before we start, I'd like to thank our sponsor, Council Services Plus, and I would also like to thank the Lavelle Fund for the Blind for its contribution that enabled us to provide American Sign Language translation with Jennifer Barrington. So I hope those of you who want to see her will avail yourself of that, and also communications access, real-time translation with steno captions. Let me now introduce our moderator, Rachel Pardoe, who's the Senior Program Officer for Older Adults, People with Disabilities, Animal Welfare, and Technical Assistance at New York Community Trust. She's joined by our panelist, Kathryn Carroll of the Association on Aging in New York, Susan Olivio from Lavelle Fund for the Blind, and Ariel Sims from Disability Belongs. Thank you all for being here. Over to you, Rachel.
Thank you, Barbara. So as good practice in making sure that this panel is accessible, I'm going to be doing a visual description. So this is Rachel. I'm a white woman with long brown hair, and I'm in my office with tons of plants in the background. Before we started, I really wanted to talk a little bit about kind of the mantra that guides the disability rights movement, and that is nothing without us. It's the idea that no decisions should be made without people with disabilities at the table. Policies and programs, even those that are not disability specific, affect people with disabilities because they are a full part of society. And when we're talking about board membership, we're not just talking about disability-focused nonprofits. We're really thinking about all nonprofits, the entire sector, and the fact that people with disabilities are taking advantage of these programs and should be at the table on the board. So to start, I'd like to turn a question to Ariel. So if you could please provide a brief description and introduction, and also frame who we're referring to when we say people with disabilities, and then talk a little bit about some of the biggest systemic barriers that the community faces.
Thanks, Rachel. This is Ariel. Hi, everyone. This is Ariel Sims. My pronouns are they, them, or she, hers. I'm a white, non-binary individual. I am wearing a dark sweater today with a black vest that has our Disability Belongs logo on it and teal glasses. I am with Disability Belongs. We are a national disability-led and cross-disability advocacy nonprofit that fights stigmas and advances opportunities so people with disabilities can fully participate in all aspects of community. So when we're talking about disability, have to start by saying there really is no single definition or meaning to disability. Disability is a very nuanced concept, and it can mean different things to different people. I am a multiply disabled person myself. I'm neurodivergent, and to many of us who are disabled and identify that way, disability is part of who we are. It's part of our identity and comes with its own culture. We also consider disability part of human diversity. It's another aspect of diversity. And it can include differences in how a person's body or mind works compared with other people, how those differences can interact with different systems and environments, and ultimately how they impact our experiences. So, for example, these interactions can sometimes result in participation barriers in all aspects of community, whether in the workplace, recreation, learning, in our faith community, all kind of places that we occupy and show up. Disabilities can be physical, they can be sensory, mental, emotional, cognitive, and more than that. They can also be more or less apparent to others. Sometimes you'll hear the term visible or invisible. Our organization, we prefer to say more or less apparent because they're very apparent to those of us who are disabled, even if they're not always as readily apparent to others. They can also be temporary, acquired, and many of us live with multiple disabilities who have any type of disability. Now, some of the big barriers, the systemic barriers that we face, I would say first and foremost is full participation. Sometimes when we think about creating access, whether it's to a physical environment, a digital space, accessibility is an afterthought and not at the kind of at the forefront and something that we think about ahead of time. So that creates a lot of participation barriers for our community in a lot of different spaces. I would say another big barrier is representation. We're often not represented in different spaces and in different places in the same amounts that we show up in the general community. We represent 1 in 4 people in the United States, for example, but we often don't see that same representation carried through to things like leadership positions and on boards. So I think those are kind of the two things I would point to kind of start the conversation.
Thank you, Ariel. That is one of the most thoughtful explanations of disability, and it really, driving home that the community is not a monolith, and that they're, really when thinking about disability, it's like the individual experience of a person. So I appreciate that. A question for you and also for Katie, as people with disabilities, can you speak to your experience as nonprofit board members? What's been valuable? Have you experienced any barriers personally? And what information would you share with a board that may be hesitant to add a person with a disability? I'll start with Katie since you haven't been able to speak yet.
Thanks. Thank you to Board Strong for making this happen, Rachel for moderating, and Ariel for kicking us off. My name is Katie Carroll. I use she, her pronouns. I am a very fair, very blonde femme woman. I'm in Albany, New York, and today in frame is the top of a dress, black and light pink and white on top, and I have a virtual background for the Association on Aging in New York, which is where I work, where I serve as the Disability and Program Coordinator, which simply means that all day, every day, I get to think about what it means to age with a disability, whether that age and disability together, whether that's aging with a disability or into disability as we age, and what that means for the Aging Services Network. I have served on many, and I identify as disabled, blind, legally blind. I kind of use all those terms. Sometimes I say, I'm a person with a disability. I have served as a board member in many, many organizations. I love to get involved in things. Going way back to very early on, I was involved with a chapter of the National Federation of the Blind, the National Association of Law Students with Disabilities, and then more recently, going outside of disability-focused organizations, an amateur radio association I served on the board of. I was chair of the New York State Independent Living Council, and I currently serve as chair of the State Rehabilitation Council to the Commission for the Blind here in New York. So I've served on a lot of boards. I've been an at-large member, but also an officer, a secretary, brief stints as treasurer here and there, vice chair and chair, or vice president and president, depending on the organization and the language that they used. So what's been valuable to me, I think might resonate with anyone, whether they identify as having a disability or not. Being a part of a board satisfies my desire to be involved in things that are important to me. Being a board member has pushed me to learn new skills and also sharpen old ones. So as chair or vice chair, I've had to lead many meetings, which takes time management and good listening skills, and sometimes mediation skills and the ability to be organized. Let's see.
And have you, I guess the other question was if you've experienced any barriers. It sounds like
Yes.
the value to being on the board is pretty much kind of the value for anyone, but the fact that people with disabilities may be left out of that professional development opportunity is the issue.
Right, which is where, yeah, that's where, thank you. Our minds were on the same wavelength. Absolutely. For many people with disabilities, we're not given access to those types of opportunities. Being on a board strengthens my connections with other people, deepens my professional network. Look at spreadsheets and financials and look at bylaws and things like that. So as far as barriers, I think what is kind of forefront in my mind today are the barriers that I don't necessarily know about or hear about. And what I mean by that is the question that doesn't get asked, the disabled person that doesn't get asked to serve on a board, that doesn't get asked, how can I support you? I would love for your involvement in this organization, but I don't know how to support you. Could you help me understand? Or the question to someone, could you refer to me to someone who you think might be a wonderful contribution to my board? Could you connect me with a person with a disability that would help my organization? So I think for me, the question that doesn't get asked is often the greatest barrier.
And just to kind of jump into that, I think a lot of people are concerned that they don't want to be offensive, or they don't want to, feel like they're putting someone down or pointing out a disability. And what would you say to that? Would you be open to those questions?
Absolutely. And at the end of the day, you're trying to improve your organization. You're trying to increase representation, like Ariel was talking about. You're trying to better your organization, and I think anyone should be open to the question. So just going about things thoughtfully and with an open mind and ability and a willingness to receive feedback is most important.
Thank you. And
so please keep that in mind.
Oh, thanks. Ariel, what about you?
Yeah, I think I would add to that, boards are really, charged with governance and leading an organization and organizational strategy. And usually one of the most fundamental ways they do that is by representing the community served by that particular organization. And we know with the prevalence of disability that we are represented in every community and in every social issue that could possibly be being addressed by the wonderful work of these organizations, whether it's addressing food insecurity or education or, parks and recreation, all of it, there's a disability component and a perspective and a lens that you're missing out on if you don't have that representation on your board. So really, disability should be part of that larger strategy to be truly representative of the community being served, because we're part of every community. And when you really think about it, every human being has access needs, things that we need to feel that we belong in a space or as part of a group, things that we need to fully participate or be engaged in what we're doing. So when we start thinking about access needs is only something that applies to disabled people, we're missing out on a bigger picture that we all have preferences, we all have different ways we like to communicate and interact with information. And if we think about board service that way, if we start from that place of what if we made board service more accessible and inclusive to everyone who serves on the board, now we're going to be getting the most out of every single board member, whether they're disabled or not. What do people need to bring their best selves into their board service? And I think if we can change our mindset and then think about board service like we think about physical spaces, digital spaces, and we start from that place of accessibility and inclusion, we're going to have more engaged boards that can do their service better, can set that strategy, can do things like fundraising, and be better equipped to perform their function.
Thank you. And yeah, if the program has accessibility in mind, it's only going to be better if it can help, more people allow access for more people. As a mother, how many times did I use elevators in the subway system? And those elevators are set up for people who have challenges walking up the stairs, which includes people with disabilities, but they are beneficial for everyone. So Susan, you haven't had a chance to speak yet, and you work closely with a board. So what information might you share with a board that is hesitant about adding a person with a disability?
Thank you, Rachel. So I am a woman with olive complexion. I'm wearing kind of big glasses on my face. I have shoulder length brown hair, and I'm working from my home office today, so my background is blurred. If it weren't blurred, you'd see, I think, a view of New Jersey behind me. So what I think happens with a lot of boards, like if people are hesitated, first of all, let me say, given the prevalence of disability writ large, I'd be awfully surprised if you found out that you didn't already have a person with a disability on your board. But I think the barrier very often is fear, right? How is this person going to get here to the board meeting? How is the person going to access the board book materials, like all those types of things? And I would just say, while that is understandable on some level, it's not an excuse not to move forward, because today at our fingertips exists just about every possibility to make something accessible and easier for people to access. And I think it's just an adjustment in our attitude. And I would say, don't be afraid. Don't be afraid to ask the questions. People with disabilities are generally very open about what they need for access, and just pursue it from that angle. And then most importantly too, just look at people as individuals. It varies by individual, but the people mostly that I've met with disabilities don't want to be defined by their disability. And they'd like to serve on a board, frankly, that has nothing to do with their disability. They want to be valued because they're a lawyer, or because they're a good thought partner, or they're a good educator, or whatever it is that they bring to the table. So just get past that fear, jump in and do it. How's that for advice? Just jump in. Yeah.
In New York City, I'm entirely New York City focused. But in New York City, we have 1.2 million people that self-report having a disability. And those are just the individuals that are saying in the American Community Survey that they have a disability. So the numbers are probably much larger. And that's the size of, the population of school children. So it's really quite large here in New York City. So yeah, I guess for all three of you work closely with boards. I know Ariel is an executive director, as well as Susan, and Katie works with her board closely as well. Can you provide any lessons to ensure that your board is representative of people with disabilities, and to be supportive of those individuals? Ariel, you unmuted, so jump in.
Sure. This is Ariel. I can start. So, yeah, here at Disability Belongs, we have a majority disabled board and a majority disabled staff, for that matter. We're a disability-led and majority disabled organization. And we really represent a cross-section of the full diversity of the disability community. So, you name it. We have board members who are blind. We have a deaf board member, people with intellectual and developmental disabilities, people with mental health disabilities, those who use wheelchairs and other mobility devices. Because we've been very intentional that being disability-led and majority disabled is important for our organization and the community we're serving, which is the larger disability organization. But again, regardless of the cause or the community you're serving, we're part of that community, so always important to have us represented. I would say in general to make sure that people are fully represented, that you do need an intentional recruitment strategy. And like Susan, I would echo that you want to recruit based on what you need for your board, the expertise, the insights, the professional representation, whether it's more expertise in fundraising or accounting best practices, program evaluation, strategic planning. The reality is disabled people are represented in every sector, profession, and industry, even if they don't necessarily disclose their disabilities up front or openly, or it's not the first thing that they tell you about themselves. Be proactive in telling people about board service, that you are committed to accessibility and inclusion, that maybe you already have an equity and inclusion strategy, and that's part of your commitment as an organization. Be clear that that includes disability as part of it. You can include that kind of statement in your call for board service. For example, it's not just for job postings to kind of put out an affirmative statement that we want to have a board that reflects the community we serve, and that includes those historically marginalized and underserved groups that we've been referencing. And I would say the third thing is really practice that commitment to accessibility and inclusion. You want to check in regularly with all of your board members about access needs. How are things going? Is there something we can do to make your board service easier? How are you finding the materials? Could we provide those in a different format? Asking those questions to every single board member will really open up what might be barriers to participation for a lot of people who are currently serving on the board. You can do regular surveys on engagement and participation and what would make things easier. When a solution, or excuse me, when a barrier comes up, work with people to find a solution and be really thoughtful about those overall board materials. Probably the number one thing I advise other organizations to do is provide your board materials in plain language and be really intentional with using accessible formats. So whether it's Word documents, PowerPoint decks, you end up converting things into a PDF, there are ways to make all of those materials accessible to the broader human community. And that way you're not waiting for a disabled board member to come through the door and ask for those accommodations.
Thank you. And Katie,
I think Ariel
Go
hit
ahead.
most everything, and I can be brief in just in my comments. One with Association on Aging in New York, or Aging and Why, the universe of people that we can look to for service on our board is limited. They can only come from certain organizations. So our focus internally right now, I'll just say our conversations are focused around making people feel comfortable volunteering for board service. And that gets at what Ariel was saying, which is the commitment to accessibility, making sure that all of our meeting practices are accessible. And having an intentional recruitment policy, talking to people about who's been represented before, who we think we need, who we think we need more representation from, things like that. And then drawing on my experience with Disability Empower Network, where I serve as chair of the board, I just want to urge people to be proactive in the relationships and with your relationships with consultants, for instance. So we brought in a consultant to do strategic planning and goal setting. So working with them to make sure that the program, what they offer, and their work with the board is all accessible. So proactive.
Thank you. Susan, do you have anything to add?
Yeah, you might think, and in a way, I guess it was easier for us. We are the Lavelle Fund for the Blind, so it would be expected that we would have representation from the blindness community on our board. And while that is true, it wasn't necessarily that way from the beginning, right? So I think we needed a board champion. We needed to make this happen, and we did. And as both of my co-panelists just said, we make sure that all of our board materials are accessible. PDFs are not accessible to screen readers, which is, the software that most blind people use. So it's simply a matter of just sending the documents in the original Word or Excel formats. Also, the board itself gets into a rhythm, right? When you have blind people in the room with you, you typically identify yourself and say this is who is speaking, because at least at the beginning, they're not used to everybody's voices. And I think people just become much more aware. If we show a video or we talk about a PowerPoint, we'll be much more descriptive in what we say, and it just makes us all better board members. I like what Ariel had to say before about practice and communication, because we practice as a board and we communicate. What's not working for you? What is working for you? What can we do better? We have people on our board, so they're blind, right? But we do not expect them to be representative of the entire blind community. We have blind people with legal backgrounds, with ministry backgrounds, with health backgrounds, with nonprofit experience, right? And so we avoid having them on the board because they are a blind person, but we are happy to have them on the board as representative of every other skill set that they bring to the table.
Thank you. So I'm going to go off script for a second before we talk about the nuts and bolts of accommodations and some resources. One question, Ariel, you just kind of provoked for me when you were speaking is, in the beginning, we were talking about the fact that the disability community is not a monolith. And when you're talking about one person with a disability, that's one person with a disability. And they may be fantastic advocates since they've been doing it. They've had a lifelong disability, essentially since they're tiny. But we also want to avoid tokenism. So a person with a disability cannot speak for the entire community. what would you say to a board that is trying to be inclusive and trying to make sure that they have representation, but can't have someone from every kind of community of disability on their board? How would they, what do you advise in terms of getting feedback and getting information from the community about their services and the work that they're doing?
Thanks, Rachel. This is Ariel. So I do think it comes back to being very intentional with recruitment and that you're trying to be fully representative of the community. So being affirmative and proactive, I think was Katie's great word of telling people that we're trying to represent the community we're trying to serve. We know that includes people with disabilities, and we want to make sure that we have that represented on our board. When you're putting together a call for board service, you can have that statement at the top, right? You can say, this is the expertise that we're looking for on the board. We want people who can help us with fundraising, with governance, with accounting, all the things that we're looking for in our board members. And then to say, and these are communities that we are affirmatively trying to represent on our board, and list the disability community as one of them. That way, those who are looking into that, who are interested in board service, know that, one, this is a place that's going to be welcoming and inclusive to me as a disabled community member, and two, what kinds of expertise that they can bring to the organization. Because we're not saying that you should just invite people with disabilities on a board for the sake of saying, there, we've checked the box that we've got a person with a disability on our board. That is absolutely tokenism. We don't want that outcome. But what we want is to send a message that we are accessible and inclusive, and that we are welcoming to the larger human community, and we want that representation on the board. And it may take time. And to Susan's point earlier, again, we would be shocked if you didn't already have a disabled person on your board, but whether or not they've disclosed that or shared that, that's a bigger question. And I hear a lot from companies like, well, how do we get people to disclose? I'm like, well, have you done all the things to make your culture one that is accessible, welcoming, one of belonging, where people feel like they could disclose? And they're like, oh, we'll say more. And then we go through all the things that they could do to make their culture truly inclusive. And they're like, oh, we haven't done that. That has to come first. Why would we expect people to bring them full selves into a space if they don't know that they're going to be fully welcomed and included?
Thank you. Thank you. Okay, so now talking more about kind of nuts and bolts and resources. Susan, you mentioned that despite the fact it's the Lavelle Fund for the Blind and focuses on the blindness community, you didn't always have blind people on your board. So could you talk a little bit about kind of the lessons you learned in bringing people who are representative of the community onto your board, and any accommodations that you were able to provide? Just if kind of any lessons in general about, accommodating, making sure that people with disabilities feel supported on a board, and the accommodations and resources that you have learned about in that process.
Sure. It will probably come as no surprise to anybody that, as my friend likes to say, there are no questions anymore. Just ask Google, because it's all right there. Like, you can even do something as simple as that, right? How do we make something accessible? And pointing back again to what Ariel said before about communication, just ask the person like what they need. And for us, it was just a matter, look, was it a little extra effort at the beginning? Of course. But was it that big a deal? No, it wasn't. It's really not that big a deal to provide board materials in accessible format for people. So I would also like to point people to a wonderful resource called AskJan, JAN.org, and JAN stands for Job Accommodation Network. And it's a resource that will point you to any kinds of help people, again, disability writ large, any kinds of accommodation that help people in the workforce, but that by definition would also help people on board service. So the answers exist. I think you just need to know how to phrase the question, and don't be afraid to ask the person.
And just to Ariel's organization, Disability Belongs, which used to be referred to as Respectability, they recently went through a name change. They have amazing resources around style guides and language guides, and I turn to that page regularly for help. So Katie and Ariel, if you could provide any other tips around resources.
I have a couple. Before I do that though, I just want to say on making, so we're talking about making the space inclusive and creating a feeling of belonging. I don't want to miss the point that, executive directors, leaders in your organizations, please consider what you're expecting. So Ariel will talk about this, right? Like laying out what your expectations of board members are and putting that in a disability context. And so one thing that I've thought about lately is the importance of, do you ask your board members to contribute financially to the organization? Are you taking into account that disabled people might be less resourced? Is there another pathway for me to contribute to the organization if giving money is just not the solution? Can I fundraise? Can I give my time? Can I contribute in another way? I also want to, Rachel, you mentioned tokenism, and there's also differentiation where you just go to the one person who identifies as disabled to like answer all your accessibility questions, right? And we want to avoid that. So I might be I might be very vocal on your board about my disability, but I'm not necessarily there to solve all your accessibility problems. So I will guide you in making your annual report more accessible, but it's on you. So I might volunteer a lot, but it may not be my job as the board member. As far as resources, there are so many great meeting guides out there. There's one that was done with the Association on Independent Living here in New York and the Department of Health. I can put those links in the chat. American Bar Association has some meeting guides. We're talking about a lot about meetings, right? Because we're talking about boards. So there's some really good resources out there. And don't forget, you can turn to Centers for Independent Living or Independent Living Centers. They're located all around the state. They are organizations that are required to have at least to have a board majority of people with disabilities, and they should be able to connect you with resources, interpreters, things like that could support your organization.
Thank you. Ariel, anything to add?
Yeah, this is Ariel. I would definitely add working with organizations, especially disability-led organizations. To Katie's point, you don't want to always turn to the one openly identified disabled person on your board and ask them all the things about accessibility and inclusion. Accessibility and inclusion is also an expertise, and there are organizations out there like Disability Belongs that have the expertise and the lived experience to be able to support other organizations to build their disability inclusion strategy, to really think through how we live our commitment to inclusion through accessibility best practices. So there are organizations out there that can help with things like this. Let's say you're working on your call for service for the board and you're like, gosh, we really want to make sure it's going to be attractive to possible candidates with disabilities. We could help with things like reviewing that call for service and one, making sure it's in an accessible format, and two, making sure there's nothing in there that could unintentionally be less welcoming to the disability community, for instance. So that's kind of a resource I would put out there as well. I think I'll leave it there.
Good. Okay, and a shout out to Board Strong, because all this starts around good governance. So if you don't have the bylaws and if you don't have the structure of your board mapped out, then how are you going to have any of these conversations about inclusivity and accessibility and ensuring that you have a strong representative board? It's just not going to happen. So it starts with governance, and it starts with a really good understanding of what board membership looks like and what you're expecting out of your board members. So Board Strong. Okay, so now kind of turning attention to, we thought a lot about the, board initiating this work. What about people with disabilities who are looking to serve on non-disability related boards? If anyone has some tips for securing board service, and what are some things that are kind of red flags that should be avoided or, discussed right away to avoid any challenges moving forward? I'll start with Susan and then open up to Ariel and Katie.
I wanted to talk for a second about people with disability who would like to serve on a board. I would say the best piece of advice I could give is network as widely as possible and let people get to know you as a person and not just as a disability. I have a good friend who says to me a lot, I'm not disabled, I'm blind, right? And doesn't want that to define who she is. And what I have found, people with disabilities are incredible problem solvers. And add them to your board and they'll help you solve any kinds of problems that Ariel and Katie were talking about before. We need help with fundraising. We need help with reaching, these communities or communication or whatever. They've had to do it their whole lives. What I would say also is don't be easy. Don't take offense easily, right? People generally are approaching this from a perspective of wanting to help and wanting to do the right thing. So those of us without disabilities or without visible, if you want to use that word, disabilities, right? We try, and sometimes we say the wrong things. The vernacular changes all the time and it's hard to keep up, right? Just be patient with us and realize that where it's coming from is a positive place and a place of strength, and we're all in this together. So when you find the groups of people who are willing to realize that inclusion means including everybody. And I wanted to just say a quick shout out to Barbara and to Board Strong. Again, thank you for pulling this together, because indeed, as you mentioned at the beginning, this is not a topic that gets a lot of discussion or a lot of attention, and it's very much needed. So kudos to Board Strong for addressing this.
Thank you. Yeah, even amongst organizations that focus their services on people with disabilities, they're just lacking on representation on the board. So I do really appreciate Barbara pulling this together. Thank you. So Katie and Ariel, what would you recommend for a person with a disability who want to secure board service?
I don't think I have anything to recommend other than to simply ask. Express your interest. I would like to be involved. I would like to acquire this skill. Be willing to, people don't always jump into an organization and start with the board, right? Sometimes it's serving on a committee, sometimes it's volunteering with a program. So you have to get to know the organization first, and just be really upfront about what you're looking for. You would like to network, you would like to gain expertise in the financials of nonprofits or something like that. So go to your network and to ask, be vocal about it.
Thank you.
Katie, I think that's, just let me jump in for a second, Rachel. I was talking to someone the other day, a person with a disability who serves on a lot of boards, and fortunately not necessarily in disability-related nonprofits. She started out by volunteering. She, had certain interests and she just kept volunteering. Then they realized what she could bring to the table. And she said, then they just asked me to be on the board.
As it is with anybody.
Right, exactly.
Yeah, same route for everyone. Ariel.
Yeah, I agree with all of that. I think volunteering can be a great way to sort of get in front of an organization that you care about, that you love the work that they do. Another way is, if you have capacity, make a donation to the organization. You probably already support the organization if you're interested in board service. So, and it can be a donation that's meaningful to you, whether that's $1 or that's $10,000. Making a donation really sends a signal that you care about the organization, its financial health and well-being, and that you might be a very good board member, whether you're donating personally or you're helping the nonprofit or the organization get resources. I would also really encourage disabled people to look at boards that have nothing to do with disability. No organizations that have anything to do with disability. We should be represented across the nonprofit sector or across the private sector on boards, and ultimately, we think this is how we're gonna change the narrative and change the systems to make them more inclusive and accessible. So we actively encourage folks in our network, look at issues that you care about, identify the organizations that you think are doing good work, and pursue those organizations. Reach out and ask about board service and have conversations. Reach out to the executive director, the CEO, and say, I'm interested in board service. I'd like to chat with you about what that looks like for your organization. Learn about the recruitment strategies, the approach, what kinds of expertise that they're looking for. And, let's say you get that invitation, ask for what you need. You do not have to disclose your specific disability to get what you need. It's okay to ask for what you need. And once you're in that position as a board member, it's much easier to say, I need these materials in a different format, or can we adjust how we do this part of the meeting because that is easier for me, and be upfront with what you need to make the most of your board service.
Yeah, I've heard time and time again from grantee nonprofits who have worked to make their programs, their physical space more accessible, that it's less time intensive to do that in the beginning, that during the planning stage and during the kind of development, to have those conversations and think about what that would look like rather than 2 years down the line after something has gotten up and running and you realize that it's not accessible. And that goes to those conversations as well, and to communicate needs from the beginning rather than kind of waiting to communicate those. The one other thing I wanted to say, sorry, Susan, were you? Katie?
Oh, no, it's Katie.
Go ahead.
Just a quick thought. I was in a meeting not too long ago, an event with a lot of executive directors of relatively young nonprofits. And I was getting a lot of questions. I said, I'm the chair of my board at Disability Empower Network. And they were like, they were just baffled that someone was so involved in their board that they would show up representing the organization. I guess they didn't have a lot of experience with like super involved board members, and they wanted advice. And when you're an organization that makes it a pleasure to be involved, like I'm sold, like I am committed. I am there. I'm going to show up. I'm going to do the work behind the scenes. So just know that you're developing a really good relationship when you make your environment inclusive.
Thank you. And the one other thing I was going to mention, I know a lot of attendees are from New York City, and there is a small group of New York City private funders that are focused on disability and can support mainstream organizations to become more accessible. So just putting that out there. Okay, so to wrap it up, we only have a few more minutes left before we turn to Q&A. The bigger issue here is that when we talk about diversity, disability is not included in that conversation. So initially I had this question posed to Ariel, since you're an advocacy organization, about how we can ensure people with disabilities are included in the diversity conversation. But I'll have Ariel go first, and then Susan and Katie, if you can provide your thoughts on that, and then we'll wrap up and go to Q&A.
Thanks, Rachel. This is Ariel. Yeah, there's some data out there that 90% of global companies have a DEI strategy or a program, but only 4% of those include disability as part of that larger DEI strategy or program.
Sorry, did you say 4 or 40?
4%, 4.
Okay.
FOUR, 4% of out of 90. I know it's ridiculous when you hear the number, you're like, really? But this is the challenge that we're dealing with. People don't think about disability as an aspect of diversity. And that's a big part of what we do as an advocacy organization, is make sure people do understand disability as an identity, as an aspect of diversity, as an identity that can cut across every other demographic and can show up in any other community that organizations are trying to serve. And I think we really start by, we do start by raising awareness that one disability is part of this conversation, and that each of us as individuals can act as champions in our spheres of influence. And sometimes that means, start by asking questions. If you serve on a board now, have the conversation with your chair. Have we had a board member with disabilities? And if not, maybe we should look into what might be the barriers that are excluding people from serving on our board that we haven't thought about. We've talked a lot about meeting individual access needs, and I think this is what a lot of people think about when they're like, oh, I have to wait for a disabled person to show up and then figure out what they specifically need. There is a whole practice out there called universal design, where we can make everything we do more accessible and inclusive from the get-go. We don't have to wait for a person to show up and be like, I need XYZ. We can change our practices from the start. And the best thing about universal design, it is for all humans. I assume we don't have boards out there that, take animal service or whatever. Maybe you do. That's great. But I think most of us are focused on human serving boards, and universal design is meant to help support all humans, and really meet the full diversity of the human communities. So really looking into universal design. And again, you don't have to be an expert. There are organizations like Disability Belongs that can be a partner to you in this and help you think through your strategies and practices that we can change upfront to make board service more welcoming and inclusive from the get-go.
Okay. Katie or Susan, any last minute things to add before we turn to Q&A?
I totally agree with what Ariel said, and I would also turn it a little bit on its head. And Rachel, you've worked with me long enough to know my mantra, right? Which is, let's focus on accessibility and not disability, right? I cannot tell you how many times I'll have conversations with fellow philanthropists, and they'll say, we don't fund disability. And I'll look them right in the eye now and I say, neither do I, right? I fund accessibility. Let's turn it on its head, because there's just the easy go-to answer for people was we don't do disability. And to be honest, I don't even know what that means anymore, right? So let's turn it on its head. I look for organizations like Teach Access, which is a wonderful organization whose mission now is to make sure that every kind of technology, every student that's in college learning about computer science knows to make software, hardware, everything to do with technology, born accessible. As you kept saying, Rachel, from the beginning, and Ariel said the same thing, from the beginning. Why don't we just have that mindset? When you look at universal design, if you're designing a house, an apartment, an office building, a park, whatever it is, just look at that universal design, because it works for everybody. And we can focus on making our lives, our programs, our open spaces, everything that we do accessible. Yeah, that's my soapbox, Rachel, right?
Yeah, you hear. Katie.
Oh, well, I think we should just get to Q&A. And
Okay.
I really appreciate everyone here, and thank you.
Thank you. Thank you. Okay, Barbara, do you want to man the Q&A?
Yes, thank you so much, everybody. That was wonderful. I do want to add and thank the panelists here. When we first started putting this together, we realized we had a lot to learn about making this session accessible. And just asking the people who you see on your screen, who are incredibly open and understanding, has brought us, two different kinds of interpretation and a lot more understanding about how to speak in a more inclusive way. So I would encourage everybody to just recognize that asking questions is not something that might offend a few people, but for the most part, it's what brings us together. So why don't we go to a question from Nancy Miller, who used to be the CEO, she says, of a nonprofit. I believe it was Visions. Yes, we all know Nancy.
Hi, Nancy.
Many of us know Nancy.
You know Nancy well.
Everybody knows Nancy, right?
Everybody knows Nancy. All right. Okay. Very few foundations ask about the makeup of a board. And those that don't ask about people with, that don't ask. When a funder asks, is it a good way to raise awareness by the board of the importance of diversity by including disability? How do we get more foundations to ask about the makeup of nonprofit boards, including if a board member identifies as a person with a disability? And I'll throw that over to you, but let me just, for the people on the call, just say, if you apply to a foundation for a grant, many of them will ask you about the composition of your board. Men, women, age, all of those questions. And I think Nancy is saying that few actually ask about people with disabilities. So throw that over to you, Rachel.
Yeah, we don't. I'm of the mindset that foundations are already scrutinizing everything that nonprofits are doing. And do you really want us to poke our fingers into another thing? I mean, I guess it's a conversation as to whether you think if it would be helpful for a funder to start asking about this. Would it then give you the leverage to push your board to be more accessible? I try to be less prescriptive, and I don't want you to have to now report back another thing to me. But I think it's an important conversation about if you could use us as leverage, or if it's just going to be like another reporting requirement. That's my opinion as a funder.
This is Ariel. What I would tell to foundations is, if it's an important part of your grant making strategy and you already ask about other aspects of identity, then sure, you should include disability as part of that. Or you should frame the question more broadly about, does your board represent the community that you serve, or represent a larger group of people if it's an organization that serves a particular population? Asking those broader questions if it serves the strategy. On the other side, I would tell to nonprofits, I'm guessing for most of you, representation is part of your strategy, that you want to have a board that reflects the community that you're trying to serve. So you can be proactive. You don't have to wait for a foundation to come along and ask. You can do things like identity surveys. That's a practice we have at Disability Belongs at least once a year. We ask everybody, our staff, board, those in our network, tell us more about you. And we talk about how we're going to use the information, that we use it for things like GuideStar and Charity Navigator and reporting on the diversity of our team at large, that we use it to make the case that this is why we can be an authoritative source on all things disability. So I'd say be thoughtful about how it fits into your strategy and then use it to help drive that strategy.
I appreciate that Wanda said it, only if foundation boards model the behavior themselves, and otherwise it's not really equitable. Yes, agree completely.
Agreed. Yes, foundations should ask themselves the same thing.
Were there other questions, Barbara? Or did anyone, Susan or Katie, did you have anything to add to Nancy's question?
This is Katie. I have nothing to add to that one.
Thank you, Katie.
I think Nancy always asks good questions, and it's worth it to explore that. We frankly ask whether the staff of a grantee organization has blind. We just collect the data. We're not using it as a carrot or a stick or anything. We just want to know, do you have blind people on your board and your staff? But interesting. I'd like to explore it more.
I'd like to explore it too, because we ask it about other identities. So we, definitely should be considering it. But again, I don't want
the
to
title.
penalize.
This is Katie. The title of this event is, diversity includes disability. And so if you're asking about, you're trying to get a sense for what the diversity of the organization is, you should be including
Oh,
disability.
totally. Agree completely. Yes, I agree.
Yeah, there are two questions that were asked like 20 minutes ago, so you actually have answered them. But I would say, just to that point, when that question comes up every year, when you're applying for a grant, it is definitely, causes people to really sit back and think, like, how are we answering this question? How has that changed from last year? And if our answer isn't, what we want it to be, why is that? What are we, I think it does cause, it sort of forces people, organizations to reflect in ways that they might put off doing and have hard conversations that they might put off doing because they're getting the impression that their funding depends on it. So whether it does or not. So keep asking. That's what I'm saying, actually. Are there any other questions? We have 3 minutes left. All right, well, that being said, I'd like to put in one more plug for our board matching platform. Just go to boardstrong.org and click on a button that says either find a board or find a board member. We do ask diversity questions. They're all optional. And for those of you who might be interested in joining a board or really think about board membership, there's also a free 5-part webinar on being a board member, on roles, responsibilities, requirements, etc. So that if you're interested in being on a board, you also know what you're getting into, which we think is important. As Rachel mentioned, we think educated board members and properly constituted boards are a really important part of our whole ethos, is that, excellent boards result in excellent organizations and excellent programs for the people that we serve. And boards that aren't that way are, I guess, leaving things on the table, as it were, in terms of the ways that they think about things, the way they can be creative, and the ways they can think outside the box around strategy, which is just another benefit of diversity. It's not only about equity and justice, but really the research that shows that diverse groups of people make better decisions and make better organizations. So with that, Rachel, do you all have any final thoughts?
No final thoughts. I just say if anyone has questions, I am happy to talk about this at length. So please feel free to reach out. I'll put my information in the chat box right now. And I know that my colleagues put their information in as well. So happy to have the conversation. And that's what it starts with.
All right. Well, thank you all for being great panelists. Thank you, Jennifer, for participating, as well as the folks running the cart, excuse me, I'm learning. Really appreciate what you've added to this session. And as I said, everyone will get a copy of this recording tomorrow. And thank you all for joining us. And you'll also be on the list for our next roundtable, which will start up the series again in January. So everyone, enjoy the rest of your day, and thank you for joining us.
Thank you, Barbara.
Thank you.